I hope you are all safe and well, and I should say sane. There's no shortage of challenges in dealing with what we're dealing, and I can't imagine how disruptive this must be to your school, to your education and your lives personally and professionally. And so, again, I do hope you're all doing okay. My name is Guy Amini, and I am the president of dentalcorp, and I want to welcome you to our first webinar with the dental student community. We're here to talk to you about both ourselves as an organization and, frankly, more importantly, the impact of COVID-19 on dentistry. I've given a few presentations, probably to some of you who've tuned in. I've had a chance to hear them, and it's very weird to speak to a computer screen where you can't see your audience and engage with them. But we do have a Q&A function enabled that'll allow you guys to submit questions, and I will certainly do my part to answer them. And I've visited some schools over the past 12 months, and I go through the slide deck where I introduce you guys to dentalcorp and talk a little bit about who we are, what we've done, and how that impacts your future careers, and talk a little bit about numbers. And it's a little weird in this climate to do that. To be quite honest, I'd much rather get to what is really top of mind for all of us, get to how COVID-19 is affecting our profession and what does it mean for all of you who are about to emerge into the industry as professionals looking to advance your own careers. But let's take a step back, and again, introductions are in order. Again, dentalcorp, the largest network of dental clinics in Canada. It's also the fastest growing, with over 400 clinics spanning every province in the country. We have over 1,300 dentists who are seeing their patients over 4 million times a year. And as an organization, we've been privileged and fortunate to have raised more than $2 billion in financing to help fuel our growth and our ambitions and what we want to achieve. And again, typically when I go through this, I'll talk about our growth and that we've only been able to do this in less than 9 years, and we've done some amazing things along the way. But again, you guys can go to the website, you guys can see all this. Let's get to the good stuff. Let's get to really what we're all thinking about. And again, we've done and continue to strike partnerships with schools, which are very relevant to you guys, investing in CE. And again, I encourage you all to go to our website, www.dentalcorp.ca, where all this information and more is available. But I do want to get through to what this all means. But before I get there, for some context, I want to take a step back and talk to you a little bit about what dentalcorp does as an organization, because it'll help inform our discussion around how COVID-19 impacted our network, what we did, and what we can learn and apply from that to the broader industry. Some people do ask, lots of students do ask, what does dentalcorp actually do? Well, it's a lot. We own and help operate the largest network of dental clinics, but we do so in a very particular way. We are not in the business of dentistry itself. That's for the dentists in our network. We are in the business of supporting them in every facet possible. When you think of the different avenues of support, that includes everything from the administrative, so doing their payroll, managing their bookkeeping, running the technology that fuels the operations of a practice, to the more strategic. So we have HR professionals that work with our practices, our dentists, and our practice leaders on everything from HR matters to recruiting to staff disputes. We've got a team of marketers who work with our dentists and work with our managers across the network on how to communicate with our patients, how to market our practice, how to get our name out there. We work with our dentists and our managers on how to optimize operations, how to think about approaching scheduling, how to think about running not just a well-oiled machine, but running a real successful dental practice that is really effective at delivering great patient care. When you combine all those things, it gives us a considerable amount of resources as an organization to manage our practices under the best of circumstances, and as we've seen over the last couple of months, under the worst of circumstances. That takes us to really what we all want to talk about, COVID-19. And I appreciate that, to a certain degree, we're all COVID-19 fatigue. It's all that dominates the headlines. It's all that dominates the airwaves. But it is It is in every way unprecedented. It is in every way a crisis of both humanitarian nature and economic nature that we've never experienced before. And it's worth us exploring and understanding and seeing how it impacts our lives personally and how it can impact our lives professionally. You know, the first case of coronavirus was officially detected in China in December of 2019. If you assume the virus was around a few months before that, which is probably fair to assume, that puts us officially in the 7th inning stretch of this crisis. And as baseball analogies go, this may go beyond 9 innings. Platitudes and hyperbole aside, 2020 will be the year that redefines life as we know it. Even when this crisis is over, it's not going to be truly over. We're going to have to live with versions of it for the foreseeable future, and that's okay, because call me optimistic, because I am. I am confident that as a community and as a profession, we will find a way to make this work for us. But let's take a step back and take stock of what's transpired since this has all started, since the pandemic hit. You know, both our industry and our organization has confronted, again, unprecedented measures and unprecedented issues. And there's a profound impact on what that means for each of you. You know, on March 2nd, I boarded a flight to Vancouver to attend the Pacific Dental Conference. And I remember before doing so, I had a conversation with my wife, who's a staff physician at one of Canada's largest primate care centers at Women's College Hospital here in Toronto. She also is leading a COVID-19 assessment center. So she has and always will be much smarter than I am, particularly around the severity of this pandemic. And she said to me before I boarded that flight that it is both hilarious in a bad way and ridiculous in a worse way that the dental conference wasn't canceled. You know, I didn't, which is usually the case with me, I didn't have much to say other than to shrug my shoulders and stress that it's not my call. With dentalcorp being the largest organization at the conference, if it was going on, I couldn't miss it. And so thousands of dentists and industry members huddled together, shaking hands, speaking moistly, and partying in cramped quarters. And it was interesting because we all knew that COVID-19 was already in Canada. We all knew countries like China, Iran, and by that time even Italy were hit hard. But we, and this applies to Canada in general, had this overconfidence in how prepared we thought we were. And in dentistry in particular, we were wrong. By March 15th, we had the first dental regulator take action. And what ensued after that was nothing short of chaos. For those of you who are following along, you would have seen regulators putting out guidance that was cryptic, where the vast majority of professionals couldn't decipher if it was an order to stop seeing their patients unless it was an emergency, or a suggestion, or somewhere in between those two. We had regulators in different provinces setting different standards where you had to navigate the differences between them. I was getting calls on a daily basis from different association members and frankly different college registrars asking me what others were doing and what we thought about it. No one really understood how to get ahead of it. Dentists didn't know what true emergencies were in this context and how to govern themselves with these regulatory orders changing day by day. And no one understood the protocols to put in place. How do I treat a COVID-19 positive patient? How do I screen for it? What's the PPE protocols or personal protective equipment protocols that I need to employ or that my staff needs to deploy in this environment? And those questions in this climate changed every day. The answers to those questions changed every day, and the ground beneath all of our feet was shifting hour by hour. But as the dust settled, what you found was that 90% of dental practices were mostly or entirely closed. There were mass layoffs, and income for the vast majority of dentists disappeared overnight. I said before, everyone was flat-footed. Even we were. And we thought we were ahead of the game. In January, we had reached out to our supplier partners and told them begin stockpiling personal protective equipment because we want to make sure that our staff have the personal protective equipment that they need to be able to treat their patients. By even February, we were already preparing safety protocols and updated infection and prevention control guidelines for our practices. And with our considerable resources, it wasn't easy, but we thought, again, we were ahead of the game. We have a risk management and regulatory compliance team in the dentalcorp that's staffed by lawyers and dental professionals who have all had experience both working in dental clinics and for dental regulatory bodies. And when this crisis hit, their phones and inboxes were hit by a tsunami. As a resource to our practice community, this group typically gets anywhere from 100 to 200 inquiries a week. They were getting that in a day. So how did we, as a large organization of dental practitioners and professionals supporting them, manage? Well, first and foremost, we knew that we had an obligation to our patients and our people on the front lines. Second, we knew that we had to take bold, decisive action for our organization, not only to endure through this, but to thrive and emerge stronger than ever. So what did that look like? Well, it started with supporting and protecting our teams. And to do that, and this applies to every dental practice, communication is at the heart. You can never do enough of it. Most of our dental practices and those who operate, so most dental practices and those who operate them had 3 questions. And a lot of independents and those who are out there on their own had no idea how to answer them. And the first is, what do I tell my patients when this is all going on? What do I do with my staff in a world where I can't see 95% of the patients I need to see? And if I have to close my practice, how do I do that? From our perspective, out of the gate, it was really important that each of our practices had an answer to each of those questions. We prepared a host of templates and patient communication protocols, because the most important thing that you'll find is that it's really important for patients to understand what's going on with their dentist. It's really important for them to know what this means for their in-treatment care. And it's really important for them to know how to navigate an emergency if they have one. When it comes to staff, what you guys will very soon realize once you're out in practices working is that the staff are the lifeblood of a dental practice. And with practices having to stop seeing patients overnight, staff are obviously very afraid for their jobs. This was before the government announced any support, and this is before anyone knew how long this was over. So we knew, much like every other dental practice knew, they had to find a way to take care of their people. At dentalcorp, we made sure that our staff's paychecks were 100% protected until the government support could kick in. Doing so wasn't easy, and it meant that we as an organization had to make sacrifices. And for those dental practices that aren't part of a large group, if they needed to do the same thing, they also had to make sacrifices. Our senior executives at dentalcorp took significant pay cuts, and some of us reduced our salary to $1, not because we had to, and not because the organization couldn't afford to, but because we knew it was the right thing to do. And for all those practices, both in our network and outside, that needed to close, but needed to figure out how to do that, we put together a comprehensive playbook for how to deal with everything you need to deal with to suspend operations. And these are a lot of things that most people don't turn their mind to. From how do I maintain my equipment? How do I manage my charts? How do I communicate with my patients? How do I set up the technology and protocols so that I still have access to those things while the practice is closed? It's important to recognize that we're able to do these things because dentalcorp is in a privileged position. We have an extremely healthy balance sheet. We've got the economic resources to invest in people and expertise that allow us to leverage and accomplish this in the course of a couple of weeks. But a lot of dentists and their practices don't have those resources. And we recognize that. And we recognize that as a key stakeholder in the industry, we have an opportunity and frankly an obligation to share these resources that we've been able to develop with the broader dental profession. We opened up our resources and made them available to anyone who wanted them. We created a COVID-19 resource site on our webpage that allowed anyone to log in for free and leverage all those same resources that we developed for their practices and their staff and their patients. We even had a provincial dental association, a couple of them actually asked us if they could send these resources to their members. And of course we said, absolutely. Here's a snapshot of some of those resources. We didn't want to stop there though. During such a gripping and unprecedented crisis, we wanted to gather the experts, consolidate best thinking, and share with the community those positive and informative resources that they benefit from. We started a webinar series where we gathered infectious disease experts, leading clinicians, legal experts, prominent Bay Street economists and wealth managers, and anyone else that we thought would have some insight that members of the profession could benefit from. We did gather what PPE we could spare and donate it to local hospitals to help in their efforts. And we're really proud that even some of our dentists tried to do their part, and were really successful in doing so. One of our dentist partners in Montreal, Dr. Rene Cassi, who's an OMFS, he created a face shield and gown combination that by all measures is the most protective piece of equipment out there. I mean, you've all heard of N95s, with the 95 referring to the degree of particulate filtration. His setup is rated N1000. And we're tremendously proud of what he's been able to do, support healthcare practitioners in his local area. But again, we didn't want to stop there. There's two key technological innovations that we felt were critical as an organization. One of the biggest challenges patients have when this all hit, and they're still having today, is access to a dentist to triage a dental emergency. If you think of all the dentists out there that didn't know what a true emergency was and how to define that, imagine a patient. And when you think of those practices that don't have patient communication protocols in place, or who don't realize they've got to update their even answering machine and how it works, a lot of their patients couldn't get a hold of their dentist, or a lot of patients who didn't have a dentist didn't know who to turn to. We accelerated our launch of our proprietary patient engagement platform called HelloDent, which is a patient-friendly portal that allows anyone looking for a dentist, whether they're traveling, whether they've moved, or whether they're looking for a new dentist where they live or work, to find one. And it is, I'm proud to say today, currently the #1 rated site for patients looking for a dentist near them or for emergencies. And we knew that we could use that as a resource to help patients find practices which are still open for emergency care. So we opened it up to do that. We also knew that to help in the fight against the spread of COVID-19, it was important that we find a way to give patients access to care from their homes. The only way we could do that is by launching a teledentistry platform. So we did that too, and we made it entirely free. Patients who want to connect with a dentist virtually can now go to hellodent.com, log in and get screened by a local dentist in their province through secure online chat, audio or video channels where they can describe their symptoms, receive prompt diagnoses, and even where appropriate, be prescribed medication. If necessary, the dentist will even refer the patient to an emergency dental clinic in their area. And again, best of all, it's all free. None of these resources or initiatives are a silver bullet to the challenges this pandemic presents to dental practices, staff, or patients, but they're a start, and they're a start that we're proud to be part of. So what will life generally look like after? It's really tough to say, because again, this is so unprecedented. Here's what we know. We are 18 to 24 months away from a vaccine, and early serology tests suggest a much smaller portion of the population has been infected than what we would have assumed. That means more than just one wave of this, likely. Based on most fundamental economic variables, we have not faced an economic climate so dire since the Great Depression. The unemployment levels we're seeing today, we haven't seen since the Great Depression. And making matters worse, oil prices have never done what we're seeing them do today. That said, this isn't the financial crisis of 2008, and this isn't a cyclical recession. This is a complete wiping out of consumer demand, but not naturally, but entirely manufactured. It's not like businesses didn't have customers, it's not like restaurants didn't have patrons, and it's not like practices didn't have patients. It just so happened that all of a sudden, they just weren't allowed to have them. And how that rebounds is entirely up in the air. So what will this mean for dentistry? On the demand side, predicting patient volumes is nearly impossible. We can safely say it won't snap back to what it was before, at least not in the short term. I mean, how many people here, to those I'm speaking to virtually, how many of you would be comfortable going into a healthcare clinic today and waiting in a busy waiting room? Some of you may, some of you won't. And when it comes to patient demand, it'll for sure be driven by two things. The first is the extent of job loss in our macro economy. The quicker we're through this, the less permanent those job losses will be. Because again, those are also to a certain degree manufactured. But the longer this drags, the more permanent those job losses become. That means more people's disposable income dries up and their benefits go away. And with that, so too does their ability to spend money on their oral care. And for a healthcare profession that is almost entirely dependent on insured benefits into private pay, that will have an impact on demand. The second factor is operational limitations. What PPE is going to be required for practices to treat their patients? Will they have to limit waiting rooms? Will practices have to ensure that there's at least a 2-hour gap or some sort of meaningful time gap between two patients being seen in the same operatory, which will again limit volumes? I.e., put otherwise, what will the supply side limitations be that impact the ability for dentistry to rebound? We just don't know. But we're not sitting on our heels waiting. We've actually just today launched a group of research members of the community who are going to do some very specific dental research into how COVID-19 and its infection is impacted by dental treatment within an operatory. There's been a lot of talk about aerosols. There's a lot of talk in other healthcare professions, in surgical rooms and ORs over what PPE is required, what protocols need to be in place. There actually hasn't been that much research in dentistry. And so we're going to do that research because we think that operational protocols, that standards around PPE, how we should govern ourselves and how we should treat our patients should be evidence-based. And that means doing the work behind it. So we're proud to be able to launch that research. You know, what about practices themselves? I know some of you are thinking and watching the industry from a buying or selling perspective. I will be honest, things will change. Most certainly the value of a dental practice will come down. You know, you can't have a business shut down for months on end, emerge with a muted demand and more expensive operational costs, i.e. due to PPE, and expect it to be worth as much. And that's not even taking into consideration the significantly weakened macroeconomy. Some may not agree with us. You know, I saw an ad from a broker just today. Brokers, for those of you who don't know, who only get paid if a practice sells and they get a commission off that sale price. The broker's ad basically stated that young dentists would rather buy an empty practice than not own one at all. I think that's personally a ridiculous statement to make, but yes, there will be some people still looking to acquire dental practices, for sure. Our prediction is that they will have a tougher time to do so. Dental practices will be more affordable, I can tell you that. I can tell you that we as an organization who are the most active buyers will not be paying what we were paying before because the economics aren't there. Demand is limited. The macroeconomy has been affected, and these businesses and these practices just are not worth as much. So yes, practices will be more affordable, and there's a silver lining for those who want to acquire. But again, financing will be much more difficult to pay for. With an economy exhibiting the variables it's exhibiting today, banks will be more risk averse, and they will have a harder time lending money to those who want to buy practices that have, again, limited demand. You know, we have strong relationships with major Canadian banks who are business partners in various facets, and they've told us they'll be far more risk averse in every capacity. And when it comes to operating these clinics, life will be more difficult. There will be enhanced safety and infection protocols that require more training for you and your staff, more overhead. There'll be more operating parameters and heightened tension for practitioners, staff, and patients. It will be a different environment. Is it all doom and gloom though? No. I firmly believe things will eventually evolve into a healthy environment for you as practitioners and even practice owners. I look at our network. I know for a fact we will emerge in a position where we will continue to look to grow, and we will emerge from this stronger than we were before. From a perspective of jobs and opportunities to practice for you, at the heart of dentistry is human capital. And that means every organization, whether it's a large group like dentalcorp or a single practice, they know the key to success is having the very best people. And I can tell you that we're looking to hire today. I can tell you that we're going to continue to look to hire tomorrow. We know that with our expertise in marketing and operational efficiencies, there will be opportunities for young dentists to find placements, in a lot of cases, get full schedules right out of the gate. I know many of you have your debt loads weighing on you in the back of your minds. And I can tell you that as an organization, we're working on a program that allows for debt relief in a tax-effective way for you. There will be some challenges, particularly in independent practices, as the owners of those practices will have gone considerable time without income. You know, they may hog OR time or take the bigger cases, or maybe not give you as many patients as they would otherwise. But look, the reality is dentistry is not going to disappear overnight. In a lot of ways, it will recover far faster and better than most other industries. Whether by vanity or necessity, people will pay attention to their oral health before they take another vacation or buy a new car or go shopping for a new wardrobe. The strong clinics will survive, and the great dentists will have opportunities. And in a year or so, when there is a vaccine, or we've gotten ahead of this, for better or for worse, this crisis will be in the rearview mirror. And in a lot of ways, there will be a new normal, but it'll be a healthy normal. And that means a healthy practice and a healthy profession and a healthy career for each of you. What can you do in the meantime? First, be positive. I graduated from law school here in Toronto in the spring of 2009, and that was right after the financial markets collapsed. And that crisis was different than this one because it was far more systemic. There was no liquidity in the markets. Banks were frozen. Insurers were going under. Companies were getting tens and billions of dollars of bailouts. And the whole system ground to a halt naturally, not because the governments forced it to. My career path at the time was to be a corporate lawyer for one of Canada's largest firms, whose 3 largest clients were major international banks and financial institutions. So I was worried, but it worked out. Things returned to some sort of different normal, and they will in dentistry. I hitched my wagon and my family's security to one of the largest network of dental clinics in the world. And I'll tell you that I am generally very confident that not only our organization will endure, but our industry as a whole will recover. So how do you get ahead of that? Be forward thinking. There's no shortage of ways you can continue to advance your skills during this time, and be diligent in this regard. One of the things that we did for our associate dentists in our network is that we made partnerships with leading CE institutions so they can access online CE for free. Again, because while you're sitting idle, doesn't mean that you can't develop your skills, can't mean that you can't move yourself forward. And be open-minded. There are new paths that will open up as a result of this crisis. And maybe they weren't the ones you would have entertained before. Maybe they're not the ones that you had at the top of your list, but there are opportunities today in an environment where things are a little bit more challenging, where there are new opportunities that you may be forced to take. Being open-minded and taking them, whether that's joining a group like dentalcorp or venturing down a completely different path, can take you to places you may not have anticipated. And those could be very positive places. I've lost a member of my extended family to COVID-19. My wife has lost patients as well. And so I don't say this with rose-colored glasses or in a manner that's insensitive to the human cost of this pandemic. The challenge this crisis presents will create a pressure cooker. And that pressure cooker in dentistry will require us and force us to innovate for the better. All of you, in a way, believe it or not, are really lucky that you're nearing the beginnings of your career versus coming towards the end of it. That means that you'll be at the forefront of the innovation that dentistry will undergo over the next short, medium, and long term. And you'll be leading the industry to what I believe, firmly and genuinely, greater heights than those of a few weeks ago. So again, be positive, move yourself forward during this time, and engage with us as an organization, because the opportunities, I promise you, will be there. Thank you, and I think we'll move to some questions now. Bear with me. Just reading the questions. This is a good question. The first question is, for those graduating this spring and hoping to be registered by work by August, should you be applying for jobs? Is it too chaotic to reach out to practices now, or would that be better than waiting? I don't think it's too chaotic. I think choosing the right practice for you, and the practice choosing the right associate dentist to bring on is a long process. It's a very personal process, and you can never start that too early. In fact, right now, people have time. People have time to engage. People have time to connect virtually like this, do a virtual interview, get to know you. And they may not understand or may not have a crystal ball for their patient demand, but they'll be able to connect and build relationships with you. From our perspective as an organization, we are still doing interviews. We've just launched a brand new interview platform that allow us to do more interactive interviews with our prospective dentists who want to join. And again, we are looking at a reopening where we can offer a lot of our dentists full schedules. We can offer our dentists an opportunity to work at more than one location, so they get a full week's worth of work. And so it's never too early. There's never a bad time to build relationships with the industry. Reach out to those owners that you may know of, reach out to organizations who are looking to hire, get your resume dusted off, and work on your interview skills. And we are actually, I think as an organization, we do have some tips on resume skills as well as interview skills on our resources sites. Leverage those, build those relationships. It's never too early to start. I think that was the only question that we had. I'll give it another couple of seconds. So we got a question: how will markets change for specialties? How will students who pursue specialties fare? It's an interesting question, because if you asked me this 2 months ago, I would have said the market for specialties was challenged. You know, a lot of the older specialists who have standalone practices, the way those practices really hum is purely by referrals. And referrals from one dentist to another are very much a personal choice of that referring dentist. It's couched in the deep relationship that referring dentist has with that specialist. And that means the practice itself has a lot of its goodwill housed within that specialist. And when that specialist retires, and there's no longer going to be there, those referring dentists may not necessarily refer to that same practice, regardless of who purchased it. And so specialists were finding themselves in a position where they didn't have many buyers for their practices. They were finding themselves where they may own their own practice, but also have to spend the balance of their week working at other practices to get a full schedule and really balance out their income. I will say that in this environment, some of the specialists are busier than they ever were. You know, endodontists right now are inundated with patients who have emergency root canals that their GPs can't handle. A lot of those specialists who deal with complex cases, extractions, and real true emergencies, again, have pent-up demand because a lot of dentists can't see those patients. And so in the short term, those specialists will be busy. I still think in the long term, it's a tough business and a tough personal services profession to transition out of ultimately. And so I think for specialists, they will always be in high demand as a professional, but whether or not that means you should be opening up your own practice or buying one, that's a different question from whether or not you think you'll have gainful employment. I think specialists who are graduating will always have opportunities to work. I just think that they'll far more likely find really lucrative opportunities working as part of practices or as part of groups where they can go to multiple practices to get a full schedule. I got another question, and it's another good one. Will there be any issues for graduates from Australia or Ireland who will be graduating at the end of this year? Currently, those dental schools are trying to liaise with the CDA to ensure the graduate requirements are still met. I don't know the answer to that question. It's very much up to the National Licensing Board, Examination Board, and provincial licensing bodies. What I can tell you is, in a lot of ways, there are a lot of questions that these boards and regulatory bodies are being asked, and they don't have a ton of resources to be able to answer them or get really ahead of the curve. I wish I can give you a more helpful answer, but I'm sorry I can't. Yeah, another question that, if I can paraphrase, is, what else can we do aside from reviewing notes or looking at resources? It's a great question. There are some online CE providers that may have some stuff applicable for new grads. One of the things that we're going to turn our mind to is how we can give students an opportunity to gain some real life experience in our practices, because we will be open and operating kind of full steam ahead as soon as we're able to. We're turning our mind to that and trying to come up with a framework where each of you who could spend some time in our practices get real life experience, either assisting or mentoring or job shadowing our practitioners. And so I don't know of any resources outside of that, but if we are able to do anything, we'll be sure to let you guys in each of the schools know so you have access to that. How will salaries be affected? Well, other than a few different specialties, 99% of dentists don't have salaries. They all get paid a portion of their billings, the balance of which is dealt with overhead. Do I think that number is going to come down? And it's tough to say. I think the great dentists will always be paid relative market comp. I think today it'll be very interesting to see how much patient demand there is and how much people are looking for opportunities to work. We're not looking to hire anybody at levels below what we were paying before, but it will always depend. Dentistry is one of those rare industries where most people are paid all around the same level. And so it'll be very much a market-driven dynamic. I think opportunities in more rural areas will obviously have compensation parameters that are likely more in line with higher percentages. I think those in urban environments are going to be a little challenged. I think people will be a little desperate for work. And usually when that desperation kicks in, it means that they're looking to maybe work for a smaller percentage. But I don't think it'll be wildly away from where it is today. Do I think dentists will be looked at more negatively since the news about PDC outbreak? No, I don't think so. I mean, I think that's old news to a large degree. There's a couple things that made headlines in dentistry that I thought were a little worse. A lot of healthcare workers right now are front and center, as they should be, in terms of garnering the attention of the broader population, because they're doing great things. And I think a lot of people may not recognize that dentists are on the front lines as well. The ability for a dentist to see a patient dealing with a dental emergency means that patient doesn't need to go to the emergency room. And most of you have seen the New York Times article, I'm sure, or seen other reports that make it quite clear that dentists, dental hygienists, dental assistants, they're one of the most at-risk professionals for spread of COVID-19. And they are very much on the front lines. And to me, that's a role they employ in the healthcare system. That's a role they play in the healthcare system that should be heaped with praise and should be recognized. But again, when you look at some of the headlines that we saw, the dental associations making a lot of noise around insurance coverage for dentists. We saw dental associations making a lot of headlines, or we saw dentists making headlines for not following guidelines and treating patients with elective procedures. And that's the sort of stuff that is not good for the profession. I think it takes away from so much of the good that it represents and so much of the positive that it does for the healthcare community. When you see headlines saying, dentists are following and still doing hygiene or still doing emergency or elective procedures, against the guidelines of their own regulator, that's the stuff that starts poking away or chipping away at the public trust, not some conference at a time where everybody was doing things that weren't, in hindsight, maybe the most responsible thing to do. Do you have hiring for new graduates in the GTA? Yes, we do. We do have some openings. I can't comment specifically on which ones. I just don't have them on the top of my head. But we do have openings, and we're always looking to build relationships with future practitioners. Just because there's no opening today doesn't mean there won't be an opening tomorrow. We are the fastest growing network, and we will be the fastest growing network. And so every day, new opportunities do arise, and whether that means you're working at one practice in the GTA or some of the other 64 that we have in the Greater Toronto area, there are opportunities where maybe not today, but tomorrow you can find a real fruitful career in our network. So, do associates have access to any benefits? It's a great question. Generally, industry, absolutely not. Most associates, in fact, I've never seen an associate in any dental practice be an employee. Most associates are independent contractors. And so that means that to be an independent contractor, you can't give them benefits. That said, just today or tomorrow, I don't know if it got out today, we're about to launch what we are calling our DDS benefits program. So that means every dentist in our network has access to benefits if they want to through our membership with Manulife. And so all of you who are members of the ODA or equivalent associations in other provinces, they tell you can get these benefits, whether it's healthcare benefits, insurance benefits, et cetera, for cheaper. We've struck a deal with Manulife, and we've made sure that we've looked at every single access to discounted benefits across the country that you get from your provincial associations. And we've struck a deal with Manulife that allows our dentists in our network to get cheaper, more affordable benefits that actually cover more than they can access through their own associations. We can do that because of our scale. And so that's something that we've reserved for our associates in our network. That's a benefit they get for being part of our organization. But they do pay for it, but it costs them a lot less than the benefits they'd have to pay for if they do it through their own associations or on their own. What is happening with banks and financing for purchasing a practice? Is it still a viable option? There's still financing, but like I said, we have pretty deep connections with the banks. banks will already starting to get a little wary of where valuations are growing, and that was before COVID-19 hit. In this environment, while they do have, again, capital, they are far more risk averse. They are looking at practices that over the last 2 to 3 months, and by the time we're through this over the last 6 months, we'll have zero operating revenue for the most part. And there's no bank that's going to lend money to buy a practice that has zero operating revenue. And so they'll wait to see what the rebound looks like. They'll wait to see what dentistry looks like from a financial perspective before they start lending 100% of practice valuations. And so there will be financing available. It will be less, and it'll be harder to get. There still will be financing available, but it will have some more scrutiny. Banks will be much more strict and tighter with valuations that they're willing to lend against, and you're going to see some tightening around the belt. Compared to other future graduates, would this year's graduates be disadvantaged or looking for jobs? In the short term, possibly. I look at our network and say, we don't view this as impacting how many people we want to bring aboard. We don't view this as impacting, opportunities to bring great people on. It may impact how busy they could be, but we're not looking at it. We're not looking at it all that drastically differently. Will a lot of independent practices that would have gobbled up a lot of new grads be affected by this? I think it's naive to assume in the short term that they won't be. But again, there's a lot of short term predicting that we can do. The tougher question, and I think the more positive answer to your question, is a long-term view in mind. And I think long-term, you guys will be okay. I do firmly believe that. Long-term, the opportunities will be there. In the short term, it just might take a little longer. In the short term, you might want to find opportunities where you're not putting all your eggs in one basket, but you're going to say maybe a group and saying, I will work a day here, a day there, and a day there in one small geographic area, rather than really looking for one full-time opportunity out of the gate. And I think it's, again, having that open mind about different opportunities presented differently that get you the same end result. Does dentalcorp support with any continuing education courses? Yes, absolutely we do. So we do have DC Institute, which is our in-house AGD PACE certified learning arm. And it has always been a leading provider of dental education to dentists and their staff alike. We have just partnered with Spear Education to offer all of our dentists in our network free access to Spear Online, which is, again, a leading CE provider. We have a host of proprietary courses that dentists in our network can access. In fact, I think we've made a lot of those resources free. A lot of online CE by leading clinicians who are members of our faculty, both independent and within our network ourselves. And so I encourage you guys to go to dcinstitute.ca. There are some resources for you to be able to access. And when life returns to normal, each of the associates in our network get access to what I'll call the Associate Development Program, which is an in-house proprietary learning journey and development, continuing education development journey for all of our associates, which takes them all the way through foundational learning. That's clinical skill sets, patient experience skill sets, all the way to more comprehensive CE. So a lot of the complicated, implant dentistry, specialist dentistry that a lot of general practitioners want to round out their practice with. We've created a journey of learning for all of our associates to be able to navigate that. And all of it, again, is free for our associates as they spend time within our network. One of the things that we found really of value to our younger dentists is mentorship. A lot of you guys, and this has always been the case, graduate and you find that life in a practice is a little bit more challenging than a sim lab. There's a lot to learn, and there's a lot that they don't teach you in school because, frankly, they don't have the resources to do that. And one of the things about our network that we have an abundance of is great clinicians who are senior dentists who've had lots of years of experience. And the best thing that they can do is pay it forward to the next generation. And the best thing they could do is act as mentors. And a lot of new grads who join independent practices, I can tell you most operators are too busy operating their practice to be a great mentor. And that doesn't apply to all of them. There are some good mentors out there. But as an organization, we saw that gap in the journey of a new grad. We saw that need for a lot of young dentists to get access to mentorship. And so we did create a formal mentorship program. We have regional mentors in our network across the country who are paired with students, or sorry, not students, but new grads who join our network. They have weekly touch points. They have in-person meetings over coffee or in an operatory and talk about cases. We've got an online, private online forum for our fresh grads and young dentists to engage with each other, swap notes. We're launching a young graduate study club where our leading dentists will host some of the younger ones, and a lot of study clubs that most young dentists can't get into, as an opportunity again to hone your skill, develop your clinical skill set, get far more comfortable treating patients with the kind of treatment that you want to do and you always envision yourself doing. And again, it's an important part of the journey that young dentists want to be able to take. Got a really good question. If we're looking to gain exposure to different types of dentistry, we're able to work at more than one practice. Well, yeah, I mean, as part of a network, you absolutely can. I think one of the things that we say to all of our applicants who are looking to join our network, for those who are open-minded, if you live in a city like Toronto or Calgary, Edmonton, Vancouver, Montreal, or frankly across the country, we have practices everywhere, and all of our practices have one common thread. They are leading practices with really strong leadership at each of those from the dental perspective. And that means that there are great opportunities to work at multiple locations, or great opportunities to work at different kinds of practices with different treatment philosophies. The one thing that everyone should know about dentalcorp is that, we don't dictate treatment philosophy. We don't dictate any sort of clinical treatment style or requirements. So each of our practices have their own clinical culture, their own clinical philosophy to boot. And, getting an opportunity to see the different approaches to dentistry, getting an opportunity to see practices approach different types of treatment philosophies and services offered, whether it's comprehensive, whether it's more your bread and butter dentistry. When you're part of a network, you have an opportunity to see all of those and decide where, again, fits more in line with what you want to do and how you want to spend your time practicing. Give it another couple of seconds, see if there's any more questions. It's a really good one. Are there legal risks with providing teledentistry? There are legal risks with everything in dentistry. The good thing is there's a lot of resources out there on how to navigate those risks. The important thing to understand about teledentistry is that you are limited in what you can do. You're limited in the advice you can give. You're limited in the diagnosis you can provide, because fundamentally you can't see that patient. In most cases, you don't have that patient's medical history. In most cases, you don't have a fresh exam to understand the oral healthcare needs of the patient with sufficient detail to be able to do the types of diagnoses you can do in person. However, you can do certain things like talk through at a high level whether or not there's a dental emergency, whether or not that's the type of emergency that can be treated with over-the-counter medication, or whether or not that's the type of emergency that they should go straight to an emergency room to handle. And so if you're going to do teledentistry as part of our platform or on your own, it's very important to educate yourself on what the provincial guidelines are, what the regulatory bodies will permit, and how you should approach it to ensure that you're not providing advice to a patient or diagnosing them in a manner that's not informed of what you need to be informed by before you do so. Does dentalcorp have multiple specialty practices, or are they GP practices or specialists working? Both. We've got a vast majority of GP practices, but we also have specialty practices standalone. And so we have a healthy combination of both. Give it another couple minutes. So one of the things that I guess it's a little hard to decipher from the outside is, do our associates get to network with associates in the organization? And it's a great question. One of the benefits that we've always heard from our dental partners who are part of the network is that they've been able to be not just part of an organization, but also surround themselves with like-minded professionals that they wouldn't have been surrounded by if they were on their own. We've got partners who joined us and sold their practice in Halifax who are best friends with partners who joined us from Vancouver, and they built a network and they built a camaraderie from that. And our associates have just as much access to that as well now. So again, from everything from building our social platform for associates to engage with each other, to now we are running associate events in local communities, bringing our associates from all over our practices within a geographic area, whether we're delivering them CE or we're just engaging with them as a network, helping them forge relationships within their profession. You know, dentistry can be very insular at times, and other than your classmates, it's really hard to connect with professionals who maybe you weren't close to at school. And you know, we've heard from our associates that's a big thing that they're looking for, and so we've put programs in place, and frankly are happy to, as an organization, find ways to engage with them because they're a big part of what we do. Give it a minute. I think there was some questions submitted as well. I will see if there's any that remain unanswered. Yeah, I think we got through all the questions that were submitted as far as I can see. But if there's anything else, I'll wait another minute. If not, we'll wrap it up, folks. Okay, look, I want to take this time to say thank you for each of you who joined. Again, it's a weird time. It's a challenging time. I don't envy the uncertainty that you're all faced with. You know, when you're in an educational environment, facing an industry from afar, it's hard to understand all the ins and outs of what's going on in the industry at the best of times, let alone dealing with what we've never dealt with before. What I can tell you is, you know, be positive. Again, I am very, very genuine in thinking that there will be a healthy recovery for dentistry. It will look a little differently, but it will be a healthy profession. It'll be a healthy industry. You guys will all have healthy careers if you stick to building your skills clinically, stick to building your skills personally. Um, and again, one of the things that is never a bad idea is to engage and build a network. Find opportunities to connect with us as an organization. We're never one to not want to build relationships. We're never one to not want to know everybody out there, who they are, and how they could fit within what we're trying to achieve as an organization. And so please do reach out to us if you have any questions. There's no shortage of channels to go do that. Please remain positive. Please remain safe. And I hope to be able to connect with each of you again in the future. Thank you.